How does a disc heal, and how can we speed up the process? Now, this is a common question that I get through my YouTube videos and also through my online How to Overcome Lower Back Pain consultations and rehab programs. We're going to look at 3 parts. So we're going to look at how it can heal. Then we're going to look at the McKenzie approach, because this is another commonly touted treatment for it, or rehabilitation process for it. We're going to build a little bit of context around it, and then we're going to look at a more effective approach. How a disc can heal. Now, there are different possibilities, but what we're going to look at, and this, I should say, comes from Low Back Disorder by Dr. McGill. So what I'm going to do is sort of read the text. This is from the textbook, which you can just see behind me there, and then I'm going to put my sort of best interpretation on top of that. So you've got the extruded material may be reabsorbed by the disc or may dehydrate. So on a normal healthy disc, you've got these, or this sort of fibrous wall that goes around the outside, and then you've got a jelly-like fluid or a gel-like fluid on the inside. So as that migrates through various processes, it can either bulge, which would be a bulging disc, or it can herniate and go all the way through. So when it goes all the way through, what can happen over time is it can be reabsorbed, which we'll touch on and talk about, or it may dehydrate. So it will then, in some respects, kind of disappear in that regard. So what we also have is an inflammatory response, and that can digest this material. So what we've got are these little organisms called macrophages, and they basically will be directed to the area, and then they will go about consuming that, digesting it, and then removing that material away from the area. And this can happen over a period of up to 2 years. And what will also happen during that time is the symptoms will reduce. So when it comes to rehabilitation, you've got sort of a process that will happen as long as we don't keep sort of triggering the pain and the problem. So it will happen. It will heal over time. What we can do to speed it up, we will look at in the next slide. As a part of my consultation process, one of the questions I ask and sort of like to delve into is any previous treatment people have had. And the McKenzie approach is something that's quite common, but certainly this exercise here, which is known as the floppy push-up. Now, the sort of the concept and the principle of it is pretty, solid in the way that it works. But with regards to some of the context that needs to go with it, we're going to look at now, because it takes away it takes away from how this is going to work for you. So, the McKenzie approach, it's based on extension postures. So this is me extending my spine. Now, what this extension is meant to do, so if we've got the material coming out of the back, the idea is we press down on the back of the disc, and then that will sort of mechanically push it back the other way, or that's the idea of it anyway. And what it can also do is create a vacuum. So in some respects, it's kind of then being sucked back in as well. So not only is it's sort of mechanically driving it forward, it can get sucked back in as well. Now, this is shown to work in people that have 70% of their disc height remaining. So there's sort of like the first context, is the person that is doing it has to know that they've got 70% of their disc height remaining. But there's a potential for facet joints to damage. So the facet joints, so if we've got, so if I just draw side-on view here, so we've got one vertebra, one disc, and then basically we've got the sort of, let's just put the wings on the back of the disc, and then the wing, they need to touch, so the wings on the back of the disc, and they sort of overlap. Well, where they overlap, it's a joint called a facet joint. Now, what can happen is when we go into these extreme extension postures is they can become damaged. So where we may get this benefit from it, we may get this drawback from it. So we have to understand these things first. So if we go through an assessment and someone has sort of inflamed or damaged facet joints, then this may not be the most effective way of doing it, or certainly to this degree of extension. So what is a facet joint? It's the two joints between two vertebrae, as I've mentioned. And the repeated extension also increases disc deterioration. So what we need to be able to do is try and find a slightly different approach, because as I mentioned at the start, sort of the concept of it and the principle of it is pretty solid. But we've got these sort of checks and balances that come along with it. Number one, we need the disc height. Number two, it could damage the facet joints. Number three, it could increase disc deterioration as well. So what we're going to look at next is a, you could say slightly modified or a slightly more effective approach. And the easiest way to describe this approach is basically just not extending as far. So as you can see here, I've got my chin on one fist. And then what I've done on the second one is I've put it on two fists. And as you can see here, we've got a slight extension and then we've got a slightly greater extension. But what we're not doing is coming all the way up and going into that extreme extension. So we're not putting the facet joints under as much stress and they're not being compressed and squashed quite as much. But what we are trying to achieve, which is part of the concept and the principle of the McKenzie approach, is trying to help drive the disc material forward. So we're still trying to get that compression on the on the back side of the disc to sort of drive it mechanically, sort of push it back down in. And obviously as we come out of that, it's going to create a vacuum to try and sort of draw it back down as well. So with these, or this approach, with the fists, one fist and two fists, again, it's not as an extreme approach, but it can be as just an effective or even more effective approach, because what we are doing is we're trying to get this benefit without as much of this drawback. So again, if we were to talk about the disc deterioration as well, again, that wouldn't be as extreme. So it doesn't put as much trauma or stress on the facet joints, and it won't deteriorate the discs quite as much. Now, I have to say this all depends on the person's pain triggers. So what you might find is that laying on the tummy actually exacerbates the problem. If that's the case, this whole concept may not be as effective as it could be for this individual. But if someone has a herniated disc and lying on the stomach helps relieve it, then it could be an effective approach. But as I mentioned with all these types of videos, this is the type of thing that would be determined during the consultation, during the assessment, because we discuss the pain triggers. We discuss if lying, for example, on your stomach exacerbates the problem or improves the problem. So we could, if you find that you're doing it already, it could be that you add this little technique in by just popping a chin on a couple of fists, and it hopefully will just speed the process up. So it has to be taken in context. It's not a one-size-fits-all. We have to understand the pain triggers and the pain-free triggers, as I call them. If you want to learn more about that and you want to discuss that further, then just go to the links in the description where you've got the online course and you've got the online course and coaching. So the online course is basically an online consultation and assessment that you work through, complete those two, go on to how to interpret the results and start building your rehab program. The coaching includes me in the process. So we then sit down, we discuss pain triggers, pain-free triggers. I then start to build your program, and then I direct you to the relevant information within the online course, and any additional stuff that I can send you as well. I'll then direct that to you as and when. So if you want to take advantage of that, just go down to the links in the description, and you can get involved in the online consultation and assessment. So many thanks for watching. My name is Chris from Chris Fold Training. I look forward to speaking to you in the next tutorial.